Hello, and thanks for joining us. Welcome to the 2022 American Diabetes Association Living with Diabetes Ask the Experts series. Today's topic is getting started, organizing your to-do list. My name is Carla Cox, registered dietitian nutritionist and certified diabetes care and education specialist, and your host for today's program. Our Ask the Expert series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, press *3, that's *3 on your keypad, and an operator will collect your question and place you in a queue so that you can have the opportunity to ask the questions. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button and your question will come directly to us. Stay with us through the hour and you will learn useful tips to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched the No Diabetes by Heart. With support from founding sponsors, the Boehringer Ingelheim and Eli Lilly and Company Diabetes Alliance, and Novo Nordisk, as well as national sponsors Santa Fe, AstraZeneca, and Bayer, the No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of coronary disease or cardiovascular disease. As part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. COVID-19 continues to be a public health threat. In general, people with diabetes who get COVID face greater challenges with maintaining glucose levels within target range. And if glucose levels have been elevated over time, they also have an increased risk of complications when dealing with viral infections. And that is true of COVID-19 as well. The American Diabetes Association encourages persons with diabetes to get vaccinated. If you have questions about the vaccination, please talk with your healthcare provider. The ADA also encouraged people to follow the guidance of the CDC and to contact your medical provider if you suspect that you are showing symptoms or have been exposed to COVID-19. For our most updated information, please visit our website at diabetes.org/coronavirus or call our 1-800 number at 1-800-342-2383. And now I am very happy to introduce Julia Blanchette as our expert today. Julia is a nurse, scientist, and certified diabetes care and education specialist at University Hospitals Cleveland Medical Center. She completed her bachelor's and PhD at Case Western University, Reserve University in Cleveland, Ohio, and her postdoctoral fellowship in integrated diabetes management at the University of Utah. She has also lived with type 1 diabetes for over 23 years and has been working with people of all ages with all types of diabetes since she became a nurse in 2014. She has a special interest in diabetes technology and barriers to diabetes self-management, such as financial stress and health insurance literacy. Julia, why don't you tell us a little bit more about yourself?
Thank you for the introduction, Carla. I'm so excited to be here today. That was a really great overview. So I work as a diabetes care and education specialist right now for 1 day a week as I'm doing research and teaching and everything else. And I have a lot of different types of experiences working with people of all ages with diabetes. I personally live with type 1 diabetes, and I have family members that live with type 2 diabetes. So something that, I have lived and the caregiver experience a little bit too. So I'm happy to be here to answer your questions today. Thank you.
Thank you. As we are waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with the first question. What items does a person with diabetes have on their to-do list different from persons without diabetes?
Yeah, that's a great one. So I'm just going to preface this with I have this wonderful checklist of like the diabetes routine care to-do list that one of my colleagues actually put together, and we actually give it to patients, and it's great. So some things on it that someone without diabetes would need to do. So every 3 months, most people need to get their A1C checked to kind of understand your average glucose and see how you're doing there with your self-management outcomes if you do not have any other metrics like CGM available to you, it's especially important. And then have your blood sugar checked at those visits too to make sure that it's not elevated. Um, the every 6 months one is really a recommendation for everyone, which is to go to the dentist every 6 months to 1 year. Every year, you have to get your feet checked and your eyes checked. So eyes, you may have a recommendation to do it more than once a year based on how your visit is. Your provider for your eyes may tell you that you need to come back more frequently than that, but it's about every year for most people. And then for feet, usually your primary care provider or your diabetes provider can do that for you, but some people will go to a podiatrist as well for that. So that's at least once a year. And then there's blood work on there, so some people may get blood work done once a year for other things, but for diabetes, we really want to look at thyroid, like liver measures, kidney measures, lipid measures like cholesterol, triglycerides, and we'll do a urine microalbumin test as well. And so that's when you have to urinate in a cup, but it'll go through with the rest of your labs. You can usually get it done at the same time. So those are all important things on your to-do list that may not be on the to-do list of someone without diabetes.
Thank you. There's a lot of things to think about, and I think that's why organizing in a thoughtful way, which we're going to talk about today, is important. If you're just joining us, welcome to today's Ask the Experts Q&A, getting started organizing your to-do list. As a reminder, for those of you on the phone, press *3, that's *3 on your keypad, and an operator will collect your question and place you in a queue so that you can have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button and your question will come directly to us. Remember, today's topic is about organizing your to-do list. So let's remember to focus on that topic for today's event when asking questions. Okay, so we do have a question that you might be able to slide over into to do your to-do list. And this is coming from Darlene. Darlene, you're on the line. She's from Philadelphia.
Hi, Darlene.
Hi, how are you?
Good. How are you?
I'm fine, thank you. My question is, and I know it may not be a part of the to-do list, but what do you do when you're on insulin and you stop taking it? Because when you do take it, your blood sugars continue to drop throughout the day. So I stopped taking
Yeah.
it. Only take it. Yeah.
Yeah. So if you're having any low blood sugars, you should always reach out to your primary care provider or diabetes provider, whoever that may be. You should reach out to them as soon as you can because we don't want you on a dose of medication that isn't working for you. And we know that low blood sugars aren't safe to be, walking around with for sure. So definitely reach out and then they may change your dose of it opposed to just removing it, or, they may decrease your dose to the point where it's removed in certain cases. But yeah, you definitely need to work with your diabetes provider on that one because stopping it, if you haven't worked with a provider to do so, you may end up with higher blood sugars too. So it's kind of a tricky situation. So definitely work with your diabetes provider for that one. Did that answer your question?
And another thing you could do is talk to your diabetes team. So beyond the provider themselves are diabetes care and education specialists that should be a part of your team. So if you have any questions, usually if you go off insulin and you've needed it at some point, you have to take some kind of oral medication to make up for that. So something to think about. Julie's absolutely right. Talk to your care provider or your diabetes team.
I totally meant all diabetes people in that. Sorry, Carla. I didn't mean to leave us out.
Yeah. So another question you mentioned at the very introduction is making an appointment to see the ophthalmologist and making sure you're doing that every year. Could you explain why in the heck you need to do that and how often you need to do that?
Yeah. So when you live with diabetes, you have risk of the blood vessels in your eyes kind of leaking a little bit. And then that can cause over time vision loss. And so we want to prevent that vision loss. We want to identify that early on. So not everyone experiences that who lives with diabetes, but we do want to screen for it to make sure that if it's happening, we catch it before it becomes an issue. And then there's also some other eye conditions with people with diabetes are at higher risk for um, as well that aren't as common as the retinopathy type vision loss. And so it's usually recommended to see the ophthalmologist or eye doctor once a year. Now, if you go and they see some of that, they might call it microbleeding. You might hear that term. They may ask you to come more than every year. They may ask you to follow up in 3 to 6 months just to make sure that things aren't progressing, or they may tell you just to come back in a year. But missing those appointments can really put you at risk for not catching that early. And we want to catch it early if it's happening to prevent vision loss.
And the nice thing about going in and having it checked is there are things they can do to treat it. So you really want to make sure that even before you have any vision loss, you're going in to make sure that you won't have any, because they can treat things. Okay, so now we have a question coming in from Florence, and Florence is from Glendale, Arizona.
Hi, Florence.
Florence.
Hi, thank you for facilitating this. So I have 2 questions for you. What is a good or optimal target range, and how do we get this checklist you're talking about in, via email?
Sure. So the optimal target range. So if you are doing finger stick glucose checks, it's recommended when you wake up, or if it's been a few hours since you've eaten, to be between 80 and 130. Sometimes you'll see 70 to 130, but under, between 70 and 80 is kind of at risk for low blood sugar. So usually we say 80 to 130. And then when you're getting your A1C checked every 3 months, the target range for most people, if you're not at high risk of lows, or if your diabetes care team hasn't told you otherwise, is usually at 7.0%. But for many people, it may be a little bit higher than that or lower in certain cases.
Perfect. And then Erin, hopefully we'll get through this again, but she wants you to be, well, she'll tell you what she wants. So Erin is from Kenosha, Wisconsin.
Hello.
Hi, Erin.
Hello. Thank you for helping us. And my question was, when you started earlier, you mentioned that we should get a A1C every 3 months. We should get our eyes checked at least once a year. Then you mentioned things that should be tested would be thyroid, liver, and kidney. And then you mentioned something after kidney, but I didn't get a chance to write it down.
Oh, I'm so glad you asked, because the last one is so important. So it's your lipid panel. So they look at your cholesterol levels.
You said a lipid, like LIPID?
Yes, that's how you spell it, lipid. So they look at your cholesterol, your total, your HDL, which is the high density, and then they look at LDL, which is the low cholesterol, and then they look at your triglycerides as well. And those are all really important to look at, because if they're elevated or too low in one of the cases for one of those measures, you are at higher risk of cardiovascular disease, and we want to try to prevent that. So it's good to catch it, to make sure we can identify it and decrease that and help lower your risk.
So I think one of the themes that's coming through is so many of these tests are not necessarily to say, oh, now you have kidney disease. It's more, okay, you're spilling something. Let's go ahead and do some kind of treatment to prevent you from having significant problems. So much of the checklist that Julie is talking about is preventative kinds of things. Getting checked first is important. So we have a written test coming in from D, and D said, I couldn't hear the type of urine test you need every year.
Yeah, so hi D. So it's the microalbumin urine test, and it's looking at one of your kidney function markers. So usually if your diabetes care team or primary care provider is writing for you to get your kidney testing every year, usually they will write for that. You usually don't have to ask for it separately, just ask for your kidney function tests, and usually they'll include that.
Great. So this is another write-in question that's great. So Mary writes in and says, I work with some older people that have used the same meter forever. Is there any time when you should get a new meter? And that obviously is part of your to-do list as well.
Yes. So that's such a good one. I have so many patients too who will tell me that, they'll get a new meter and they'll be like, my new meter, it's broken because it doesn't match my old meter. And I say, I think the old meter is a little old. So I always recommend insurance will cover a new meter once a year. So just do it. You don't have to keep it until until it dies, because they aren't good after a year or two in a lot of cases. So there is an expiration date. It kind of varies based on the meter, but I always say, if insurance will cover a new one once a year, just do it.
Okay, great. So we have a question here from Allegra. Allegra's from Baltimore, Maryland. Allegra, you're on the phone.
Hi, Allegra.
Hi. Hello. I just wanted to know if you start experiencing neuropathy and you're on insulin and metformin, is it something that you can do other than take pain medicine?
Yeah, that's a really good question. So, there's neuropathies, it's not so straightforward, but some people will get it like right when they're diagnosed from their blood sugars running higher for a while, and it might subside a little bit as blood sugars start to go down, but other people may get it after having diabetes for a long time. And I actually recommend, I don't prescribe, but I always tell the people I work with on the team that prescribe, it's best not to go with painkillers right away, right? Because we know those are addictive. So the best thing to do is to try to bring down your blood sugars into range if they aren't already. And then there's a lot of things you can do. So there's a couple types of medications. They may send you to a neurologist for those medications, though. I know not all diabetes providers are comfortable prescribing them. And there are a couple medications that kind of work on calming your nerves a little, and they're not necessarily like opioid painkillers. And then some people will use like heat packs, or there's different types of like creams you can get. Some of them are prescribed that kind of relieve a little bit of that pain. And then there's a couple over the counter creams as well. So definitely talk to your diabetes team if you're experiencing neuropathy pain. It's not fun and it can be really frustrating. But there are a couple ways to kind of relieve it a little bit, or try to, if you're experiencing it.
So on the to-do list, if someone's having neuropathy in their feet, would you also put on that to-do list seeing a podiatrist?
Absolutely. And that's because when you can't feel as well in your feet, you want to make sure that nothing else is going on. And so going to a specialist like a podiatrist will really help make sure that, nothing else is happening, and they'll make sure that your feet are the most protected they can be. They'll help you get the right type of shoes that are supportive, and all of that. So that's definitely, I think if you don't have neuropathy yet, getting the screening done from either your primary care provider or your diabetes care team is good. But if you do have neuropathy, definitely asking for a referral or going to a podiatrist is the best thing to do, because you are at a little higher risk of other types of foot complications that we want to, help you prevent. So
Prevention's key in this game. So, Adrian's from Pensacola, Florida. Adrian, you're on the line.
Yes,
Adrian.
my question is, what does the liver have to do with diabetes?
Well, the liver, is that what you said?
Yes.
Yeah. So people with diabetes are at higher risk for something called NASH, which is non-alcoholic. I don't even, Carla, I'm embarrassed. I don't even know the full abbreviation, but it's the non-alcoholic liver disease. I'm embarrassed. I don't know the SH right now. But it's non-alcoholic liver disease. And so definitely screening to make sure that your liver labs aren't elevated. That's important. But also if you take certain medications, we want to make sure that your liver function is okay, because sometimes we'll have to change your medications for diabetes a little bit too, based on that lab.
Great, thanks. Okay, we have another online question coming in, and I can help you with this one if you need it. To what extent can exercise diminish diabetes? How does exercise help, and what app regarding frequency of exercise would be optimal? And I think this could be definitely on the to-do list. So let's talk about exercise a little bit.
Yeah, this is totally Carla's area, guys. She does have an exercise physiology background, and I'm a nurse, so I will answer, and then I will let Carla add on. But exercising 30 minutes a day ish, or about 150 minutes a week, with some strength and resistance training in addition, really helps you keep your cardiovascular system um, in check if you're able to exercise. But what it also does is it increases your insulin sensitivity. It helps you use that insulin if you make insulin, or even if you take external insulin. It helps you use that a little bit better. And so it just has a lot of benefits overall, but it also helps you use insulin. So if you have diabetes, you have some what we call the beta cells, which are in your pancreas and make insulin. They may be a little bit damaged, or they may not even be there based on the type of diabetes you have. So exercising really helps kind of reduce a little bit of that stress if your beta cells are under stress, and it helps you just utilize insulin a little better. And apps, I'm going to leave to Carla because she is the person.
So, just like Julia said, I think one of the biggest strengths of exercise is that it helps cardiovascular system, and that's true whether you have diabetes or not. So you're not being singled out because you have diabetes. You're being singled out because you're a person that needs to regularly be active, and we all need to be active. So that's number one. With diabetes, the big piece is that it does reduce insulin resistance, meaning that your insulin works much better. There's actually almost like little doorways on your cell surface, the muscle cell surface, that improve, and they open, and they allow insulin to get into the muscle cells, and the glucose then to go in. But it really reduces insulin resistance. And a lot of people find that they need a lot less insulin during exercise. And maybe if you exercise every day, you'll need less insulin overall. And that's whether you have type 1 or type 2 diabetes. So those are the big strengths. And also, I think as people get older, if you incorporate a regular exercise program, then it increases your ability to do acts of daily living. I mean, you can pick up groceries, you can sweep the floor, you can do things as we get older that if you sit in a lounge chair and don't get up and exercise, you're going to start losing that function because it slips away pretty quickly. So those are the advantages to exercise. Hopefully, we answered your question. Christine has a tough question because I'm not sure we can answer it directly, but give her maybe some resources to find the things that she wants. So Christine, she's from Vancouver, Washington, and you're on the line.
Hi, Christine.
Hi. I'm 31 years old, and I was recently diagnosed with type 1, so it's all a bit overwhelming for me right now, just trying to wrap my brain around it. And I'm trying to find out if there's a CGM or an insulin pump that you would recommend that's better, or one that maybe is one of the better options for people with type 1.
Yeah, so that's a really good question. So there's a few insulin pump and CGM options. They all have different benefits. I wouldn't say one is better than the other, especially for someone with type 1. I think, first of all people with diabetes can benefit from CGM, and then anyone that uses insulin can totally benefit from an insulin pump. So I think, Carla, what do you think is the best resource? I'm trying to think. Diabetes wise, Corey Hood's website is really cool. It kind of walks you through the different options and asks you a few questions, kind of like based on your need. But do you have any other resources off the top of your head, Carla, for that?
I think collectively there aren't any better resources than diabetes wise. However, you can go to each one of the sites and see each one has their own uniqueness. For example, the Omnipod is tubeless. Some people like that. The Tandem Control IQ actually listens to the sensor so that it makes adjustments, and is sort of like a hybrid closed loop system where it's becoming similar to an artificial pancreas. Nothing is there yet, but that has that advantage. And Medtronic has a rendition of that as well. So I think all three of those are FDA approved pumps. And so you can go onto their each website So Omnipod, Tandem, and Medtronic, each one of those is unique, and you can get on and see
Okay.
what seems to fit your lifestyle the best, and
Yeah.
certainly talking to your diabetes team. And then sensor-wise, the two that are most common are the Freestyle Libre, which is less expensive, and it doesn't connect at this point in time with any
Yet.
pump.
Yet.
Yet. It's going to be soon, but not yet. And the Dexcom, which is probably the most popular one used by people with type 1
Yes.
diabetes, I would say. But you can look at Freestyle Libre and Dexcom, and I would get on their websites and look, and then you could do a comparison with Diabetes Wise. So that's what I would do. I don't think I could say that one of them is remarkable compared to the others. They're all different and have their own unique pieces, and they all work.
Yeah, and
Thank you
Christina,
so
the
much.
other thing too is that there's a lot that's probably coming out. Not a lot, but there's at least one that's probably coming out in the next couple of months. So you may want to ask your diabetes team about that too. I don't know what I'm allowed to say and what I'm not allowed to say on here, so I don't want to go into things that aren't approved. But there are things coming out too. So just talk to your diabetes team about that. You can look up. There's diatribe.org is a good website that kind of tells you, they have some pipeline articles that you could look at too, just so that you know what's coming out too. It's kind of fun to look into that. So
Great. And there is a note in the chat that if you go to the website my.clevelandclinic.org/health/9811-insulin-pumps. So, but I think if you Google Cleveland Clinic insulin pumps, you'll probably get that site. So that would be another place where, and the Cleveland Clinic is a wonderful resource. So that would be another place where you could go.
I used to work
So
there. Just had to throw that out there.
yeah. They've got a great, excellent team.
Yeah, it's awesome. They're awesome.
So we have another write-in question, which I think is a good one. I'm not sure that it's just our list of things to do, but it's a good question. Where can I find resources for LADA diabetes? And LADA, for those of you who don't know, is a some people call it type 1.5, but it's actually latent autoimmune diabetes of adulthood. So Julia, you want to talk about that a little bit?
Yeah, so LADA is so hard because I feel like you're in your own category sometimes, but sometimes you're not. And so Beyond Type 1, even though it's called Beyond Type 1, has quite a few pieces written by people living with LADA that you might find helpful and supportive. So that is where I would go, actually, to be honest. And then when you're working with your diabetes care team, sometimes it can be hard because you may be in a slightly different boat than what a lot of other people with diabetes are in. But I think using them for support when you need it is great too. So
Great. Here's another question for you. Looking at medications and ordering things from the pharmacy, how can you put that into some kind of a list to do or organizing it? And a second question to that is, some people feel like they can just rely on the pharmacy to keep them up to date. Could you go over that? So two things. How do you put your pharmacy requests in order? And can you just rely on your pharmacy to do that?
that's great. Okay, so I am a huge math and data person. I love spreadsheets. So I personally, for my own tracking purposes, I have a spreadsheet. So you can use, if you have a computer, you can use it. You can draw it out even. So I have all of my diabetes supplies and medications. One is on their own line, and then I have the supply I get. So is it a 30-day? Is it a 90-day? And then I have where I order it from. So sometimes I use a durable medical supplier for certain supplies, and then pharmacy for others. And then I have when my prescription will expire, so when it has to be renewed. And then I keep track of it that way. But I think it's really not as much as the pharmacy is trying to be helpful with the refills and everything. You really need to also think about, when does my prescription expire, and what do I need to ask my diabetes care team for ahead of the curve? So if you have an expired prescription, for example, and the pharmacy tries to refill it, you may have quite a bit of a delay. And so kind of staying ahead of that and trying to ask and advocate for yourself ahead of time to kind of fix those issues so that it doesn't turn into a delay is really ideal. And the other thing that I've been noticing a lot recently is certain pharmacies seem to be back ordered on certain medications, like different types of insulins. So I highly recommend, if your insurance allows you, ordering before last minute is best, especially because what I've seen in the past few weeks with some pharmacy delays, I think it's due to the whole international the supply chain issues seem to have even impacted our insulin and that kind of stuff. So, really staying on top of it. If your insurance allows, filling your medications before you totally run out. I highly recommend doing that as well. And if you're on autofill for your pharmacy, they're just going to do it once a month or once every 3 months. So, those are my personal tips. Carla, do you have anything else you think that would be helpful?
No, but I think not relying on your pharmacist. I mean, they're wonderful. They are. They send a text and say,
Yeah.
your next refill is there or whatever, but you really need to have some kind of organized system to generally, if you go to the physician, your primary care once a year, your prescriptions should be up to date, but sometimes
Yep.
that doesn't happen. So don't ever rely on someone else. It's really your
Or
responsibility in the end.
you may have a situation where like your prescriptions may be up to date, but maybe you had one that wasn't expiring at the same time as the others, so they didn't
Right,
renew it. Like there's weird
right.
nuances like that. So definitely keep that in mind. And while Carla was speaking, I forgot one tip. So I actually put notifications in my personal calendar. So I have an iPhone and I use my Apple Calendar. So the day when I want to refill my continuous glucose monitoring supplies for my blood sugar, um, I put a reminder in to make sure I do it because I don't want to end up without that supply at any point in time. So that's also a tip.
Great. Thank you. We also have a question coming in from Cindy, and she wants to know the nutritional facts on the foods that is bought in the store. What is the difference between sugar, added sugar, and how to calculate all that up? I assume based on the carbohydrate content. So could you kind of address that, and then I'll help you as well?
Yeah, this is also a very Carla question since she's a dietitian and I'm a nurse. But hi, Cindy, thanks for that question. That was great. So I think a lot of people get really focused on the sugars and the added sugars. So you really want to focus on carbohydrates for your people with diabetes that you're working with. But the added sugars is a very nice indicator of a lot of times how processed the food is. And so, we want to recommend to everyone, not just people with diabetes, to eat balanced and to try to stay away from processed foods if possible. So I always say the added sugars will kind of give you that indication of how processed it is sometimes and how it really may have it may make your blood sugar rise a little faster sometimes. There's other things you want to look at too, like fiber and protein and fat content for that as well. But you definitely want to just focus on the total carbohydrates. And I know the sugar is there, and we always are told there's so much sugar in the American diet, so it's hard to not like look at it. But the carbohydrate content is really what impacts blood sugar the most. So just try to stay focused on that.
Yeah, and I think, if you're eating a meal, staying away from the heavily processed foods is good for everybody. And once again, a food plan for someone with diabetes is really no different than anybody should be eating. It's well balanced, it's got some protein, it's got lots of vegetables in it, and it's not heavily processed. So we all should be doing that, right? And if you have a cookie, you can have a cookie, you can have sugar in it, but you don't want to have 10 cookies. So that's kind of where you want to be with the nutrition. There is a really nice website, a food hub on American Diabetes Association. Someone else had called in and said, where can we go? And it's really nice. So if you Google the American Diabetes Association on diabetes.org and look for their food hub, you'll find a lot of good recipes and suggestions for menus and things like that to help you eat healthfully when you have diabetes. So why are there so many specialists that we have to put on a list when you have diabetes? I mean, it's like it's never ending. So particularly if you had diabetes for a while or you had it for a while before you were diagnosed, why are there so many specialists? Why can't you just go to a primary care guy or woman?
It would be so lovely if we could just go to one person, right? But the reality is, when you've lived with diabetes undiagnosed for a long period of time or just lived with diabetes for many years, you have a higher risk of complications, per the the trials that have looked at people that have lived with diabetes for many years, the longer you live. And diabetes really impacts a lot of different body systems, right? When you have that higher blood glucose, concentrated in your body, it impacts so many body systems. And we really want to be preventative. And so you could go to your primary care provider, but another component is that they only have 20 minutes, if that, to spend with you. And so we really want to make sure we're looking at the different components that are really impacted by diabetes over time, and that we are getting the most thorough assessment we can with a lot of these different specialists. And so I know it seems like it's a lot, but it really will help us better identify risks for these complications and prevention and even treatment if they start to occur at an earlier stage to prevent longer term complications.
Great, thank you. So we have a question coming in from Mary. That's a good question. Here it comes. Mary from Dallas, Texas.
Hi, Mary.
Hi. Hello, hello.
Yes, Mary, you're on.
You're on.
Okay, so my question is, would the folks on the presentation make some kind of list for us about what to do with a sick day protocol, things that we might need, such as food or liquids, or, what to do and when to do, and also when we travel, what information do we need?
That's great. Both of those are great. And so good news is that lists already exist for those. Carla, does the ADA have a direct link for the sick day protocol anywhere?
No, I don't believe so. I mean,
No?
that's something that generally the physician will provide them with, but I think there is a little bit of a checklist that
Yeah.
you can
So
look at. So
So it's somewhat individualized, but there are general things. So we want everyone to hydrate, right? We want everyone to check their glucose more frequently than they usually would. Certain people will need to be more cautious about checking for ketones when they're sick than others. And then different people may not be able to take certain types of medications that may higher blood pressure based on the situation. And then just thinking about if different cough drops and cough medicines have higher carbohydrate content. Different kinds of things like that. So, and then, your diabetes care team may have different thresholds for high blood sugar when they want you to call them on sick days. So, and then also thinking about lows on sick days if you're on insulin, if you have any GI upset. So I know there's some sort of general checklist somewhere on the internet. It's not going to give you your specific glucose thresholds for when you should call your diabetes care team, but it should at least give you a general idea. And then for the packing checklist, what you want to do is you want to bring 2 times the amount of everything you would normally use. So if you check your blood sugar 4 times a day, you're going to bring enough to check it 8 times a day, right? For the amount of time that you're there. Or the other way you could look at it is if you're going away for 7 days, bring enough supplies for 14 days. So kind of figure out what all of the supplies and medications you use and then double it. The other thing for traveling is always wear medical identification if you have it, especially if you're traveling alone. And then you always want to keep your medical supplies with you and not in a checked bag or anything like that.
great, thank you. And we have Shanti's been on the phone for a long time waiting. Her question is not really about a list, but let's listen to her question because it's a good one. Shanti from Detroit.
Hi, Shanti.
Hi. I wanted to know how does, because I have type 2 diabetes, and I wanted to know how does it, and I have glaucoma. I wanted to know how does that relate to each other?
Yeah, that's a really good question. So I wish I knew a little bit more. I just know that having diabetes increases your risk for not only the retinopathy, which is a microvascular type complication, but it also increases your risk for cataracts and glaucoma. Carla, do you know a little bit more about the glaucoma link? I just know that it increases your risk.
Yeah, I'm not as astute on that as I'm retinopathy.
Yeah.
I will tell you though that the American Diabetes Association has an Ask the Experts Focus on Diabetes program the third Thursday every other month, and it starts in February. So they will address all the questions on diabetes and the eye. So something you might want to look at their website and see. There will be a session just on glaucoma coming in from
Oh,
an
cool.
optometrist or ophthalmologist. So that might be a good place for you to get a lot more information. We have a question coming in from Lynn from Hitchcock, New York. Lynn, you're on the phone.
Hi, Lynn.
Okay. Hi. My question, I guess a three-part question. Is there an acceptable or a good amount of carbohydrate to have when you're type 2? But the main part of the question is, I'm confused about, I've been told that it's okay to eat legumes even though they're high carbohydrate because they don't spike your blood sugar and they take a long time to process. How much truth is there to that? And the last part of the question is, I understand there's something that you're supposed to do, like subtract the fiber or the protein from the total carbohydrates to get your net carbohydrate intake.
Yeah, these are great questions. And I think these are really commonly thought about questions when people think about diet. So, the first thing I want to say, carbohydrate wise, there are, I think it's seven different types of eating patterns that are, that are recommended essentially by diabetes care specialists and diabetes experts for people living with diabetes. So, it's not really so cut and dry. Certain people do well with lower carb, certain people do well with really low carb, other people eat higher carb and eat balance. So I think thinking about your carbohydrate content and portioning is definitely important, but working with a registered dietitian, diabetes care and education specialist, they can really work with you to identify your individual needs and figure out a diet plan that works best for you. And so that's what I recommend if you really want a concrete answer on that. It is individualized. So I would recommend asking for a referral for a registered dietitian who can work with you for that if you haven't done so. So legumes, the legumes question. I am a huge fan of beans and legumes because they are a power food. They are a carbohydrate. They have fiber. They are a protein. They have so many nutrients. So they are not bad. First of all, I don't like using the words good and bad when it comes to food because it is, it's a nutrient that helps you, or maybe it's one that's a little more processed. But from that standpoint, like if you're just eating legumes compared to a slice of white bread, the legumes will not raise your blood sugar as much. And that's because they have protein and fiber. Whereas like the slice of white bread doesn't have the protein or fiber in it. But I wouldn't say they're necessarily bad because they're a carbohydrate. They're actually very balanced. So that's something to think about too. And then I'm trying to remember, the last question was about net carbs, I believe. And so with net carbs, I wouldn't worry about net carbs unless you're working with a registered dietitian and that's one of the things you're focusing on, because that's kind of complex and it adds a lot more to think about when you're eating. But it really has to do with the fiber content. And of course, foods that are higher in fiber are usually going to impact your blood sugar less than foods that don't have fiber. So that's kind of like the basis of it, but I wouldn't worry about like figuring out the exact amounts and like if you're on insulin, how to dose for it, unless that's what your dietitian that you're working with is recommending.
Yeah, and I think the fiber question is one that's still not resolved even in the national organization. So
Yeah.
depending upon your sensitivity to insulin, particularly people with type 1 diabetes might want to subtract their fiber. Generally with type 2 diabetes, particularly people on oral medications, that isn't as important. But talking to a dietitian, I certainly recommend as a good choice. We have another person calling in, and is asking the question about what do you do when you get a colonoscopy. I think that something, and we'll let her talk as well. But I think one of the things to look at is, do we put that on our long list, and would that be something you certainly are not going to probably need to do that at age 30 just because you have diabetes. So you might think about that. But Robin, what was your thought when you're calling in?
Well, you have to fast before you go in. You can't eat, and it's like I usually go by what the doctor says, but it's really hard for a person with diabetes to go through a colonoscopy.
Yeah, and I think this applies to a lot of different surgeries where you're going under anesthesia. You a lot of times you can't have anything by mouth after midnight or for a certain amount of time before the surgery. So, if you are on diabetes medications, especially insulin, definitely talk to your diabetes care team about your specific plan. It may differ based on the medications you're on, but with insulin, we don't totally stop insulin before surgeries. So that's also something you should definitely talk to your diabetes care team about. There's certain orals that we would stop 24 to 48 hours before surgery based on the situation. But if you're finding that you are having low blood sugars before a surgery and that's happened to you, please talk to your diabetes care team because the preventative types of things like colonoscopies are still really important and recommended for all people at certain ages and for certain reasons. So I wouldn't skip it just because you have diabetes. There's definitely ways to work with it. It's definitely still recommended.
Okay, great. Thank you. Here's a question. Do you think a diabetes care and education specialist is an important part of the list? And how does that differ from seeing your primary care physician?
That's great. Well, so Carla and I are biased, obviously, because we're diabetes care and education specialists. So obviously, I'm going to say we're great and so valuable. But I think we spend our whole time talking about diabetes and your concerns about diabetes and figuring out what can we do to help you with your diabetes. And I think with primary care, a lot of times they have like 15, 20 minutes to go through a lot of things, right? And so they may say, okay, what's your average blood sugar? Like they may look at that and they may make a slight medication change, but they really don't have the same time to go into depth about the whole picture with diabetes with you, like a diabetes care and education specialist has specific dedicated time for. And so I recommend anyone living with diabetes see a diabetes care and education specialist. There's times when it's more like kind of emphasized that you should see one, and those would be during like big life transitions. So, like the transition from pediatric to adult care, if you have any new complications that present, and then if you're transitioning like to a rehab from a rehab center home, like those kinds of situations, and then older adults when you transition into that time of your life, it's definitely recommended. But in general, I think seeing a diabetes care and education specialist once a year or just kind of more on a regular basis. So when I say once a year, I mean you schedule the appointment once a year, and then the diabetes care and education specialist will work with you as needed, kind of after that one appointment. So once a year, if even if you don't think you need it, sometimes we may be able to focus on some things that can really help you improve your quality of life that you may not have dug into otherwise.
Yeah, and I think generally it is a more individualized approach. So it's not just looking at a algorithm and saying, "Oh, your blood sugar's here, we need to add this," which works, but it's really individualizing and asking you what your needs are and looking at the numbers and seeing how it can the treatment plan can best suit you as an individual. We need to kind of wrap this up. It's been a great hour. But Julia, could you give us 3 key takeaway points you want to make sure the listeners take home when it comes to organizing your list of many things you need to do when you have diabetes?
Yes. So the first thing is think about the things that you have to do on an annual basis, every 6 months and every 3 months. So I reviewed those earlier on in this call, but definitely lay those out. So every year it's going to be your retinopathy screening and then your labs. So that'd be the thyroid, lipid, renal, liver panel. I think I said everything there. And then getting your feet checked if you don't already have neuropathy. And then if you do have neuropathy, going to a podiatrist as needed. And then every 6 months would be going to the dentist, which is also recommended for a lot of people without diabetes. And then every 3 months would be your blood pressure and A1C. And then for most people, every 3 months would be a diabetes provider or primary care visit to talk about diabetes. Then you can add in the other specialists like dietitian and diabetes care and education specialists every year or as needed. I think I covered everything there. Hope I didn't leave anything out, but definitely keeping a list like that together is great. My second biggest tip is track all of your medications and supplies. Somehow organize and figure out what you need, and do not try to not let yourself run out of it, because running out can become a huge problem, and we really don't want you to be in that type of situation. So tracking that and following up and advocating for yourself with that is so important. And then the third tip is just working with your diabetes care team for any support, or if you need help identifying what's on your to-do list, working with your diabetes care team is something that we're happy to help you put together a list, right? That's individualized to you. So
Great. Thank you. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you and hope you will take a few minutes to provide us with your feedback. To help you feel confident about your ability to manage your diabetes and heart health, we encourage you and your loved ones to talk to your doctor and dietitian about your risk. Go to knowdiabetesbyheart.org and learn more. Register for the next event at diabetes.org/experts. Sign up for the diabetes education near you and sign up for ADA's free Living with Type 2 Diabetes program. Links to these resources can be found on our registration page, diabetes.org/experts. Thank you for all of your great questions you called and wrote in with. We're sorry we're unable to get to everything. If you have questions about this event, you are welcome to contact us at askada at diabetes.org or by calling our 800 number 1-800-342-2383. Thriving with diabetes takes a team, and we're here to support you. Special thanks to our expert, Dr. Julia Blanchette. I am Carla Cox, and on behalf of the AD team, we want to thank you for joining us today, and we look forward to connecting with you at our next Ask the Experts event, February 8, Keeping Your Heart Healthy and a Whole New Lineup for 2022. And now, please stay on the line for our short survey. So getting started, organizing the to-dos list. Thank you for joining us today. We appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. For participants online, please click on the poll section below the Ask a Question form and click to submit your response. Okay, here's our very first question. Number 1, overall, how satisfied were you with today's event? Getting started, organizing your to-do list. Use a scale of 1 to 5, with 1 being not satisfied and 5 being very satisfied. So press 1 for not at all satisfied, all the way up to 5 for very satisfied. That question again. Overall, how satisfied were you with today's event? Getting started, organizing your to-do list. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. While we take a moment for the next question to come up, I'd like to remind you about one of our programs supporting people living with type 2. I'd like to draw your attention to a resource the ADA has for diabetes-friendly recipes called Diabetes Food Hub. Go to diabetesfoodhub.org to find and search for recipes to try, learn about nutrition, and sign up for a newsletter to receive regular tips for managing your diabetes with food. Again, that is diabetesfoodhub.org. Okay, on to our next question. How often should a person with diabetes see an ophthalmologist? Press 1 for when you're having vision problems. Press 2 for annually. Press 3 for every 5 years. And press 4 for only when referred to by your primary care provider. Okay, that question again. When you have diabetes, how often should you see an ophthalmologist? Press 1 for when you're having vision problems. Press 2 for annually. Press 3 for every 5 years, and press 4 for only when referred by your primary care provider. Before we go on to question 3, we would like to let you know that if you missed a part of today's event or would like to listen again, we now have full recordings available on our website. Go to diabetes.org/experts and click on the past recordings from all previous calls. Okay, here's question 3. My pharmacy keeps track of my medication supplies and will not let me run out, so I can ignore keeping track. Press 1 for true, press 2 for false. Again, Question number 3, my pharmacy keeps track of my diabetes supplies and will not let me run out, so I can ignore keeping track. Press 1 for true and press 2 for false. Before we move on to the next question, we would like to remind you again that our next Ask the Experts Q&A event, Keeping Your Heart Healthy, is February 8. To register, go to diabetes.org/experts or contact us at 1-800-342-2383. Okay, 2 more questions. Question number 4. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, and press 3 for very likely. So question number 4 again, as a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, and press 3 for very likely. While we await the final question, remember that a diabetes self-management education and support program will focus on your concerns about diabetes. The program will help to empower you with the knowledge and skills to help you manage your diabetes. A link to find an ADA-recognized diabetes education program can be found at the bottom of our Ask the Experts webpage, diabetes.org/expert. Or, once again, you can call our number at 1-800-342-2383. Okay, question number 5, our last question. As a result of this event, how likely are you to sign up for or to continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, and press 3 for very likely. Thank you for staying with us and providing your feedback on today's event. We offer many thanks to our expert, as well as our support vendors and sponsors and No Diabetes by Heart collaboration. Thank you, Julia. This concludes today's program in our Ask the Experts Q&A series. Please check out our website for recordings from this event and additional resources. And lastly, if you have any additional feedback for our team, please stay on the line and leave a message. Thank you so much for joining us, and we'll see you February 8th.